Dirk, Renee just send you the new background. Please check it out.
I know. Get there. Sweet.
Everyone, I'm Renee Willis. I work with the ASF team here at the FAO Regional Office. Before we begin today's webinar, I'd just like to invite you all to use the Zoom chat function throughout the talks if you want to make some comments. But if you have some questions for the speakers, you can put those in the Q&A box. And we'll also be monitoring the chat function for people who are joining on the YouTube live stream. So as we approach midday, I'd just like to hand the floor over to Philip Klaus. So I'll just hold for a few minutes, and when we go to midday, I'll introduce Philip. Thank you.
We still have 2 minutes, right? So we can wait a little bit. So.
We can see colleagues are joining to this webinar. Please give us another 1 minute to start the webinar soon. Thank you very much.
Okay, thank you, everybody. I'd like to hand the floor to Philip Klaus. Philip is the officer in charge for FAO's Emergency Centre for Transboundary Animal Diseases. Philip will give today's opening remarks for the webinar on African swine fever management for smallholders. Thank you, Philip.
Thank you, Renee, and thank you for already introducing the long name, so I can just say ECTAT instead of the whole long list. So I would like to welcome all of you on behalf of ECTAT and on behalf of Kashen Wong-Sataponchai, our regional manager, who is traveling at the moment, so I'm filling in for him. So I really would like to welcome you all on this today's webinar on African swine fever management for smallholders. I would really like to thank, of course, USAID's Bureau for Humanitarian Assistance, or BHA, of the United States of America for their support in paying for this webinar and for making this all happening. I also really would like to thank our virtual learning center here in ECTAT RAP for running this webinar very professionally. And I think this webinar will really provide you with a nice overview how we as FAO try to work to support smallholders and for ASF control, biosecurity measures, etc., and how this information can give you some useful overviews for all the training resources and methods that are currently available in spite of any ASF vaccination for now. So I think first Uni, our regional coordinator for African swine fever, will talk about all the FAO's regional efforts to control ASF. Then I see that Professor Dirk Pfeiffer is here, so I see he survived his trips to Geelong and Singapore. Happy to see you virtually again, Dirk. So I know Dirk, as an expert, he will talk about the development of the guidelines for ASF prevention and control in smallholder pig farming in Asia, with all the support from his team at CTU or City University of Hong Kong. And then last but not least, I see that Caroline is also here from PhilVet, who will present some of the details of the work that her organization, PhilVet Animal Health Services, has done and is doing in terms of the practical utilization of these guidelines. So they developed training materials with us and worked on the implementation of community approaches to increase resilience of smallholder farms against ASF incursions. So having said that, I won't take too much of your time. I hope it will be a very enjoyable webinar. Please don't hesitate to put your questions in the chat. There is no stupid questions, only stupid answers. That's what people told me. So don't be shy, have a very interactive session, and I wish you all a very good morning or afternoon or evening, wherever you are connecting in this world. And with this, I will hand it back over to Uni. Uni, back to you.
Thanks a lot, Philip, for a warm welcoming remark and also introducing all the speakers. Welcome you all to coming to this webinar today. My name is Uni Oh. I'm coordinating ASF program for our region. This time, I will give you shortly on the efforts from our region to control ASF. Oh, my clicker is not working. Sorry for that. Okay. So ASF, as you already know, ASF is not easy to differentiate from other swine diseases. And the virus itself is quite stable and resistant, so it survives a long time in the environment and all. And there is no effective treatment, no vaccine, and it's not really causing disease for humans, so it has not food safety concern, but we still need to think about the food security for ASF. African swine fever is affecting to all pigs, domestic or wild. But since it traveled a long way to Europe, Asia, and now in America, so the disease is not anymore African disease. It spreads to everywhere. In our region, as of now, total 17 countries officially reported ASF. A very recent case in Thailand and Nepal. And from FAO side, we are updating ASF situation every other week. And you can just check on our website on the latest ASF situation in Asia and the Pacific. So for the coming to the regional effort to fight ASF, we developed this ASF regional collaborative framework for our region together with OA and our member states. The main objective is to prevent the spread of ASF and also mitigate the impact of ASF in our region. We have 5 pillars and 2 cross-cutting issues, and through the research, we should understand better of ASF, and through the risk assessment and risk mitigation measure, we need to find an effective approach for ASF prevention and control. And since our region is becoming endemic, turning into endemic situation for ASF, we also need to consider business continuity and recovery. And through the proper regulatory framework, we need to strengthen the policy and also risk communication and awareness material is very important for, especially for ASF. We also need to develop required capacity from technical and operational both aspects. And also we need to enhance collaboration and coordination at multi-sectoral, multilateral, and multidisciplinary way. Then our region, under the regional GFTAD, Global Framework for Transboundary Animal Diseases, under this pillar, we conducted series of regional consultation, and also we established standing group of experts in April 2019. And we continue to have SGE meeting even under the pandemic situation. Soon, we are going to resume our SGE meeting from early next year. We also conducted some gap analysis from our member states. And nonetheless to say the most constraint faced by member countries were biosecurity, especially in smallholder pig farms. So we tried to find this way to support our smallholders. Our region is producing more than 60% of global domestic pig population, and most of them are in a lower biosecured system. And by the household number, 80 to 90% are smallholders in the Southeast Asian countries, and still illegal movement is happening across the border. We are still at risk for ASF spread. So FAO, we are taking multidimensional approach to combat ASF by improving preparedness and response by veterinary authorities, and strengthening risk communication, analyzing the value chain, engaging private sector, assessing the economic impact, and building capacity for lab diagnosis, and engaging community for this work. So far, we provided numbers of trainings, and we also developed guidelines, and we conducted small studies, and also we developed some of the communication materials. We conducted series of training at the regional level as well as in country level. We could train some number of more than 850 veterinary officers in country level. And now we are moving towards to support target community and community animal health workers. For this work to support the smallholders, we also came up with this conceptual framework to support pig smallholders. We need good management practice through the practical guidelines, and then improve ownership using governance and incentive management, and early warning by detecting early, communication and awareness and education, and also engaging private sector. Especially for this ownership and early warning, we need to utilize community animal health workers and also the local authorities such as village head. So in line with that framework, we developed guidelines to support smallholders together with Professor Doug Pfeiffer's group. All of these guidelines are available online. And together with feedback, we also further developed training materials to utilize at the community level. You will hear more from Professor Doug Pfeiffer and also Dr. Caroline Benigno after my talk. So the concept of approaching our community engagement program, we have now these practical guidelines covering preparedness, response, and recovery. Then conducting series of training at the field level, including awareness campaign, then identifying champion farmers and select community to conduct pilot of interventions at the community level. Then the intervention should be consultative and participatory by the participating community or farms. Then we will do some change of practice and also the infrastructure. Then we will conduct impact assessment and scaling up. This is planned for the next 2 years in our program for some selected countries. We also developed numbers of awareness material. First one was the Be a Champion Farmer animation video. You can visit our YouTube and check this video. This video is also available in multiple languages. And also using the infographics in this video, we also created farm biosecurity poster, also in multiple languages. And furthermore, we developed more e-cards targeting different groups. This one we already finished, but we are soon releasing them one by one with on our social media. Then we have more posters developed on what is ASF, Q&A kind of one, and also guidelines on biosecurity, and also differential diagnosis for African swine fever for animal veterinary officers. This much is it. Thank you very much for your attention. Thank you. Over to you, Renee.
Thank you, Uni. Thank you for that overview. I'll just ask you to turn the speaker off. Thank you. Hand over to Dirk now. He's going to share his talk. Welcome, Dirk. Thank you.
Can you hear me? Can you see my slide? Oh, Zoom.
Yes, thank you. That's showing well.
Zoom is complaining. Oh, God.
You still with us there?
Okay. Are we okay?
Yes.
And okay, there we go. You can see my slide. You can hear me.
Yes, thanks, Dirk. You're good to go.
Okay, excellent. Sorry for the glitch. We've been playing around too much with backgrounds, and Zoom didn't like that. So, okay, now, I mean, thank you very much for giving me this opportunity to introduce the guidelines that we've developed for African swine fever prevention and control in smallholder pig farming in Asia. And what I would like to do is start with a little bit of a background of the context, because I think that is really important to consider when trying to appreciate the complexity or the challenge that we have in dealing with African swine fever in these systems. So therefore, I'll go briefly through the value chain for pork food systems that is of relevance in the region. We often, when we think about value chains or food production, or pig production, I should say, we think about the farms primarily, but one has to be or understand that there are actually various inputs to these systems, which may also influence the maintenance of the virus in the system. And it may be meat, or it may be the pig genetics, it may be feed, it may be imports of animals. So then we've got a whole range of different types of farms, and what we are from large integrated farms down to small farms, and what with our guidelines we are focusing in particular on the small farms in smallholder farms. So that then the connection between those farms and the consumer is rather complex, and I don't want to go through that in detail, but I think it is important to just show how many steps there are involved. And it doesn't stop there with the consumer. There are also other mechanisms running in parallel. For example, what is happening, the question is what's happening to the dead pigs that are being collected, the food waste, and how that might find its way back to the farms where the virus is able to move through that system and thereby create a very difficult or very challenging situation to deal with. A few pictures of the types of farms that we are talking about, and these are just some examples. Uni mentioned before that in some parts of the region there's still pigs will being fed or food waste, and one might argue that that's a very effective way of utilizing any waste used by restaurants, etc., which is what we actually domesticated pigs for originally. But the African swine fever virus is very well capable of surviving in such waste, and thereby this habit of feeding food waste has been an important mechanism of maintaining the disease in various food systems in the region and beyond. The other aspect is the transport, and that's another mechanism of connecting between farms and slaughterhouses, but also just between farms in terms of trucks going from farm to farm and thereby potentially taking virus across. And they can take different types of transport, more advanced, maybe more biosecure types, and very small scale and therefore more risky types of transport. And then there are the slaughterhouses, the transport of the meat, and finally the retailing of the pork. Now, for this virus, all those parts of the food system play a role for spread and transmission. And what I'm trying to do is with this then is when we think about how can we best manage the disease, which is what we've been trying to reflect in the guidelines, is to address the different pathways that are relevant for introduction of African swine fever to pig farms. So one is the contact with the neighboring farms through various mechanisms as depicted here. The other one is via the slaughterhouse and movement of trucks back and forth. The other one is through the retailing and the processing. And there's also illegal activities potentially, and the role of wild boar, which may also present a factor for introduction of the virus to farms. And finally, there's introduction of movement of pigs, live pigs or pork between countries. So even, I mean, that already shows how many dimensions this question has. And when we then come down to the smallholder farm, which is the, one realizes the challenge, and we need tailored and realistic and sustainable approaches that have to be taken by local stakeholders into the local context and communicated to farmers, such that we can make a difference in terms of what we want to, where we want to go with this virus, whether we want to eradicate it or whether there may be a need to accept endemicity in different parts of the region. So that is basically, I guess, the context within which these 4 documents have been developed. And there is a logical sequence amongst them, and I will go through them, each of them one by one, very briefly. I mean, I can't do really more in this presentation. What I would like to do before I continue is just recognize the contributions of the different authors. So the people mentioned, including our colleagues from FAO who worked with us on these guidelines, have done a tremendous job. In fact, a very challenging job to put these documents together. And I'll start off with the first one, which is, I mean, with all of these diseases, we need to have ways of effectively detecting them. And we felt it would be useful to provide a document, develop a document that looks at this challenge from a smallholder perspective, and that goes through the theory, the principles of surveillance, starting off with the objectives. What situation are we in? Is African swine fever virus actually present, or is it absent? And because that will actually result in quite different surveillance approaches that are needed. We are discussing and recommending ways in relation to how active and passive surveillance can be optimized. And obviously, as with most infectious diseases, passive surveillance is usually most important. And then bring that, I mean, being realistic about what can actually be achieved, and that is usually synthesized in terms of the sensitivity that these systems and timeliness that these systems, surveillance systems, can provide in terms of the ability to report or detect the disease, which is particularly important when the disease has been absent and may have been introduced. There are also questions of case definitions, and Uni showed some nice infographics which are being used in the region to communicate to stakeholders what they should be looking for. The other aspect that is providing, making the situation more difficult is the emergence of low pathogenicity strains. And we've actually, we are working at the moment on a revision of that surveillance document, which will take account of that new situation. So I don't want to go through this in detail. I mean, we've been trying to make them easy to use, and by having graphical flowcharts that allow the users to go through the different steps of the process that they have to, where they have to make decisions in relation to the design of the surveillance system, which makes it hopefully also more transparent to any other stakeholders. The second document is about, I guess, once one has detected the disease, what is to be done, and with some key questions to be addressed in terms of what still the most important method to dealing with this disease. The standard method is culling, and there are some various issues associated with that, and one important one is also the disposal of the carcasses, and then what to do in terms of cleansing and disinfection, and for how long to destock, or when can the farm be repopulated. I would say that this section in particular needs to be reviewed on a regular basis, because there are alternatives to culling being used. I mean, large-scale culling, and one of them is selective culling, where only parts of the farm that have tested positive or where the disease has been found are culled, but we need to have the scientific evidence in terms of from independent studies how well that is working. There's the question of wild boar, what to do with wild boar, and also the engagement with the private sector. But this is quite a contentious issue, particularly with small-scale farmers when large-scale culling is being conducted. Obviously, there's usually compensation, but it's very difficult for farmers to then get back into business and to maintain their livelihoods. Again, this is supported by a flow diagram, hopefully making it easier for users to go through the complexity of this document. Now, the third document, maybe this is the most important document. As Eunice said, the most important aspect is really farm biosecurity. And this is what is the main emphasis of this document, although it also looks at slaughtering and restocking. We're trying to make practical recommendations in relation to best biosecurity management practices, and also what can be done during movement in terms of how the risk of a spread can be kept at a minimum. And I think it's also important to emphasize to the farmers that improvement of biosecurity should also reduce the risk of introduction of pathogens other than African swine fever. And those pathogens are likely to be those which will adversely affect productivity of the pigs. So the aim is really to address this or incentivize farmers on the basis of arguments for improved productivity and therefore economic benefits also for the farmer. And again, that's supported by diagrams describing the different aspects of the decisions that have to be made when improving biosecurity on the farms. The last of the 4 documents is a very ambitious one, and it's thinking about the way forward. And we really developed this clean chain approach on the basis of the compartmentalization concept, where we've written some guidelines for WOA, which those guidelines are not really appropriate for small-scale farmers. So here we've tried to develop something that we hope will be useful for farmers in areas where there's endemic infection and where one can provide them with the mechanisms how they can maintain or continue production and supply of pigs, even if there's an outbreak in the surrounding area. This is, as compartmentalization, would have to be based on a strong public-private partnership. It would have to rely on the use of risk-based tools, and also as mentioned at the bottom here, it's the public-private partnership and local stakeholders, and will really have an agreement and have work for the same goal to make this a successful exercise. And again, there's a diagram that guides through the document. Some final comments. We've been looking at this virus for a long time now. I mean, for quite some time, a number of years also in Asia, and we realized that it's we haven't really got there's not an end in sight. Whether we have to live with the virus, and that's being debated, is an issue. Vaccines, as Uni said at the beginning, there are no vaccines. I mean, there are some prospects, but I would have to be cautious there. So how are we going to support the smallholders who the large farms are, in a way, they can establish proper biosecurity protocols, etc. They have their ways of protecting their farms from the virus, but it's much harder for smallholders, and that's where our guidelines are aiming for that target group. The key will be for them to improve biosecurity, and as I mentioned, it's not just how do we incentivize, how do we communicate that, and to me it's about the generic benefits for productivity. And our hope is that people will try the idea of clean chains and as part of production cooperatives together with government veterinary services to enhance the economic benefits also. And finally, I emphasize that these guidelines are living documents because they require feedback also from the field, because some of it may have to be adapted, not some of it, probably a lot of it may have to be adapted to new knowledge, but also the experience in terms of things that haven't worked in the field. And we look forward to having that information, and then we'll work together with FAO on a revision of those documents. My final slide, I just wanted to, this is, I think, this Chinese character here actually is, just brings back to the importance of pigs, you know. The pig as part, the character for house is part of the house in there. So pigs are important in this region here. And I think we should keep that in mind. Thank you very much.
Uni or Renee?
Thank you, Dirk. Thank you for that talk. We can certainly get an appreciation for how much work's gone into the process of putting together the guidelines. Well, actually, the process is still ongoing, like you say, living documents. Our next speaker, Caroline's going to talk about her work with a company, PhilVet Animal Health Services. She's been adapting the information within the guidelines to training programs and passing on knowledge to smallholder communities. Caroline's pre-recorded her speech. She's not quite trusting of the internet. So I'll just pass the floor to Caroline and then load her slides when she's ready. Thank you.
Yes, thank you, Renee. Good afternoon to all. I'm glad I did the recording because there's a heavy thunderstorm where I am right now and I might be cut off. So I'm ready. You may present the recording. Thank you. Should be on the.
We're willing to participate.
Oops.
Yes.
You should start from the very beginning. Thank you.
And the
Oops.
good day, everyone. Let me show you now how these guidelines.
Sorry for the technical glitch. We will resume this video again.
It will run on its own. No need to click.
Good day, everyone. Let me show you now how these guidelines were adapted on the ground. We implemented 3 activities where the guidelines were carefully explained and applied to pig husbandry in a smallholder setting. First, the development of guidelines into applied training courses. From the guidelines, a training workbook was developed and used in the conduct of training in countries like Papua New Guinea, Cambodia, and the Philippines. The training workbook had one scenario where the provincial
Sorry, the sound was quite low, so we will adjust the sound again and play again. Sorry for this.
Good day, everyone. Let me show you now how these guidelines were adapted on the ground. We implemented 3 activities where the guidelines were carefully explained and applied to pig husbandry in a smallholder setting. First, the development of guidelines into applied training courses. From the guidelines, a training workbook was developed and used in the conduct of training in countries like Papua New Guinea, Cambodia, and the Philippines. The training workbook had one scenario where the provincial veterinarian had to deal with an ASF incursion. Since our participants came from remote areas of the countries where internet signal is not consistent, a virtual classroom was created where the participants can log in whenever they get good internet signals. The workbook can be accessed and they can answer or even post questions to which the facilitator can reply to them in the classroom. Participants found this approach very manageable and gave them time to think over the scenarios and the questions posed at them. Eventually, the training has been transformed into training modules for a VLC course. Second is the demonstration of proper cleaning and disinfection. From the guidelines, cleaning and disinfection had a lengthy discussion on the topic. So we developed an illustration on the steps to cleaning and disinfection. And for smallholders to better appreciate how this is done, a video demonstration of cleaning and disinfection was developed with real-life cleaning and disinfection activities. The third is the Community ASF Biosecurity Intervention, or CABI. CABI is a 5-month project where the community agreed to put in place a set of biosecurity interventions. There was a project implementation team to oversee the interventions. The objectives were to strengthen the practices on swine raising, determine knowledge of the smallholders on ASF, and assess the economic costs and impact of the interventions. It was a 5-month project that commenced in February of this year with the site and report recipient selection to turning over biosecurity materials, monitoring the activity, and gathering data for analysis. The site was in a village in North Cotabato where pig raising is a major contributor of the farmers' livelihoods, and members were willing to participate and the area has been ASF free. Some of the pictures when farmers were being briefed on the CABI. So there was a biosecurity orientation, inspection of backyard farms, and data collection on management practices. The agreed intervention was a set of biosecurity measures that the farmers will put in place, and these are fencing made of local materials, hand washing station, foot baths with disinfectants, and cleaning and disinfection materials. A proper turnover of materials signaled the commencement of the activity. And then constant monitoring was done for the next 3 months. Then on the 5th month, data and practices and economics were gathered and analyzed. And on the last month, a biosecurity booklet was developed and left with the farmer to foster a habit of recording. So the results and discussion, there were 20 participants, 11 males and 9 females. In terms of general management practices, questions on inspection of pigs, separating sick pigs, cleaning and disinfection, consulting animal health workers, reporting of unusual disease mortalities were posed to them before and after the implementation phase. And the observations were that cleaning and disinfection was commonly practiced by the farmers. However, they mentioned that they only clean their pigs but do not know disinfection. The study noted a significant increase in the number of farmers who are now concerned on reporting unusual pig mortalities to authorities. Farmers are also now informed that separating sick pigs are important to prevent disease spread. On biosecurity practices, there was a notable change in the practices in terms of washing hands, changing clothes when attending to pigs. And since the farmers were provided with biosecurity paraphernalia, the farmers are now practicing proper measures to prevent disease spread. And these are changing clothes, changing and disinfecting booths at the pig entrance, prohibiting unauthorized people to enter the farm, disinfecting vehicles during entry to the farm, and designating separate offload sites when selling pigs. In terms of swine trading, again, these are the recorded changes. And in terms of their practices towards purchasing and selling pigs, most farmers have now improved in terms of inquiring about the history of the animals before buying, isolating new arrival of pigs, monitoring the pig health status and keeping health records, as well as prohibiting buyers, traders inside the farm. On awareness on ASF and biosecurity, the farmers appreciated the regular monitoring activities and technical discussions with the project team, as they are now more knowledgeable on how they can improve their biosecurity practice. In terms of knowledge assessment and on ASF and biosecurity, there was marked improvement on the knowledge levels of the farmers on ASF and biosecurity after the project. In terms of investments and CAVI, the total investment for each farmer amounted to USD 317. While this seems to be a big amount for a farmer, it should be foreseen as an investment to protect the farms from any potential disease spread. It must be noted that there was an ASF outbreak that happened in a nearby village, but this pilot village was not affected with ASF as because of the biosecurity measures implemented. So these are some of the pictures before and after the interventions were put in place. So this example of the fencing made of local materials, the footbath which were built by the farmers, another example of fencing and footbath. So in summary and conclusion, increasing efforts to improve awareness on ASF and biosecurity practices is very important to instill among swine raisers. Second, community involvement where village officials have a vital role in stewarding biosecurity showed promising results in this study. Third, along with awareness, provision of support will allow the farmers to implement biosecurity practices. And lastly is that investment by government towards improvement of biosecurity measures is more cost efficient than to pay compensation to each ASF affected farmer. So with that, thank you very much, and I'd like to acknowledge the funding support from USAID and FAO and our partners in the field. Thank you.
Thank you, Caroline. Thank you for recording that session. Sorry about the glitches there at the start.
Thank you, Renee.
It's great to see the information that's being prepared actually filtering down and affecting change in the field. So we've actually got a presentation that our intern here at FAO RAP has put together. She's taken some of the materials from the Virtual Learning Center course on ASF. This course will be released in the very near future. We were hoping to have it online for today, but we should get there very soon. So thanks, Urgent, for putting this together. And Emmy, if you can share that talk, thank you. That's great. Thank you, Arjun. So we have a few more minutes left, and there's one question in the Q&A section. It's quite a long one, so I'll read it out and invite the panel speakers to put their inputs in. So the ASF situation and dynamics in the region are still unclear, and the endemic situation of ASF in the region continues to threaten pig production. What are the barriers and solutions to encouraging smallholders to engage the surveillance and reporting? Without real-time ASF reports and warning, implementation of CABI, risk-based surveillance and monitoring, etc., it looks like we're in for a long marathon without knowing when to rest, stop, or run faster. How to cope with the fatigue and frustration of those smallholders or community biosecurity practices, particularly when pig production is losing money. Wow, who'd like to step in and have a go with that one?
You want to give it a go, Carolyn, but I can also. Let me start. I mean, this is this is a problem, and we've had lots of meetings, and we've been thinking about also recently in Geelong. This came up again. in terms of also the way how we look at this disease, how we're going to deal with it, and the issue of culling in situations where we have outbreaks of African swine fever, and then the traditional government response has been to cull the affected farm, but also neighboring farms, etc. And then the question is how much compensation can you pay? So I think we need to reflect on how we deal with what are realistically endemic situations, so that we can protect farmers' livelihoods. And not, there's a little bit of a danger that people will now start to think the vaccines will come, and then they do not have to change the ways how they run their businesses. Part of it is, as Uni has said earlier, improvement of biosecurity is essential. They won't get around that. And it's not just a benefit for African swine fever. There'll be some investment, economic investments that they have to make, but it's often also just a better understanding of what behaviors precipitate the flow of pathogens, including African swine fever. The other aspect, the feeding of pig's will or food waste, which still is common practice. I mean, one mechanism would be to not allow it anymore, and that's in high countries, that's a possibility, but there's also the possibility to process it. So there are no straightforward answers to this. We're also thinking about recommending developing strategy for containing it in certain areas where that opportunity arises. So we need to have good surveillance, we need to have good information out there from the field in order to have develop policies that are useful for not just the large farms, but also the smaller farms. So no straightforward answer. Anyway, I'll pass on to Carolyn.
Yeah, when we were doing these community interventions, I just thought of government really having very general programs to announce and neglecting the village level smallholder. So I think it's going by the experience of putting in place community interventions here was an eye-opener, because the smallholders themselves appreciated the constant orientation and monitoring, and the team left a booklet for them it's like a review and to record. So it's really not neglecting the village level of or the smallholder farmers, because sometimes in announcing government programs, these are very general, holistic. We tend to neglect what the smallholders really need. So if it means village by village, then it is possible, because there is a network of local government units on this. It's just a matter of really of devoting or committing time and effort to look after the smallholders. That's
can I just add to that one further? And I think, Carolyn, you mentioned that at the meeting last week, we mentioned the community animal health workers, and I think that's what you're saying. And there's good experience from the Philippines in terms of involving them in the response, because they have the trust of the local community, and maybe that's something we need to promote and engage them in the action and in enhancing biosecurity across the region. There's some countries where this works well. In other countries, I mean, where there's a well-established network of community animal health workers. In others, it's not so well established. So I think we need to go back to that. And I would actually argue it has benefits beyond African swine fever to strengthen the network of community animal health workers. Thank you.
Thank you very much. That's certainly some good talking points and a very thorough response to a broad question. There are a couple more questions here. Another one on anybody updates on the possible production of ASF vaccine. This is certainly an inevitable question with our ASF webinars and information sessions. So I'll hand to Uni to tackle this one.
Well, so far, only one official announcement was made from Vietnam. They started a bigger trial in the country earlier this year. However, it was suspended due to some sudden peak deaths. So, well, the answer is so far, vaccine is a bit far to put into the measure for control ASF just yet. So biosecurity is more an answer to tackle ASF. Thank you.
One further question here. It seemed that border control is ineffective to stop the spread of ASF virus. ASF is still spreading and it seems unstoppable. Is there really a way to stop the spread?
I mean, I shouldn't laugh. Actually, and I think it reminds us. You know what this reminds of us is that the production systems and ecosystems are all connected across the region. So we think often in national contexts, but the reality there's a lot of movement of people and products, and also even pigs or wild boar, okay, across the region, and therefore. I would argue, I've worked on this disease since 2005 in Europe and in Africa, and I would say it is unstoppable with the tools that we have at the moment. So what we can do is we can mitigate it and limit its impact that it has on farmers' livelihoods until vaccines are available. And maybe just to add to the vaccine question, the issue, one problem with the vaccine question is that there are some illegal vaccines out there that are used in some places, and we very much discourage that. But we can understand that smallholder farmers feel that this may be a solution for them in some places, and because they're desperate and they don't see. And particularly, what I would say is vaccines are one of those things that people, if they're cheap, people like them because they mean you don't have to change your behaviors. You get something else as long as it's not expensive, and you can keep running your business as you always have. But with this disease, we need change in the way how farms are being run. But we'll have to figure out how that can be done in a cost-effective and culturally and socially acceptable way.
Thank you, Dirk and Uni. Oh, sorry.
Yeah, sorry. Just may I add that I've noticed, especially in the Philippines, where provinces have their own ordinances, cities within provinces have their own ordinances stopping movement, and it's really not working. So perhaps look at working as a group, not as an administrative boundary, but work as a group of provinces, or to really look at border control, not a city, not treat it as one land mass, perhaps, and probably there's some more positive result for. Yeah.
Can I just add to that? It's a transboundary disease. It's a classic transboundary disease. It doesn't care about boundaries. It moves through ecosystems, eco-social systems where there are pigs, domestic pigs and wild pigs. You'd have to build a lot of walls, but walls, there's usually a hole in the wall. So we need to, exactly as Karen says, we need to think, work together on this. And that's within countries across provinces, but also across the region. And that's, I think, where FAO was playing a really good role in trying to get a regional approach, develop a regional approach towards managing this disease.
On that regional approach, we've also got a question in the chat box asking whether the VLC course will be available to people outside the Asia Pacific region. So I'll pass on to Uni for that one.
Actually, the course will be open for all. So it's a e-learning course. So It's open for all. You are welcome to join. We will announce the exact date of opening later through our social media. So please follow our FAO Asia Pacific Twitter, and also we might arrange something releasing the message. And also on the bi-weekly update, we are sending to all the CBOs in the member countries in our region, so that information also will be shared among CBO list. So please stay tuned and stay connected. We will announce soon. Thank you.
And just finally, we've got one more. I guess it's more an observation in the question and answer section from Cambodia. The main challenges are poor biosecurity amongst free-range pigs, and movement of people and pork products is complex. So thanks for that input, Siddharth from Cambodia. So that's rounds out our webinar for today. Apologize for the few little glitches there with our webinar function. I guess the pandemic might be winding down, but we're still getting used to these online and mixed platforms. Thank you very much, Dirk from City University, Caroline from PhilVet, and Uni, of course, from FAO here. Thank you.